A Michigan farm worker is the first person in the state to catch bird flu. According to state health experts, he worked closely with livestock that had the virus.
They say the worker has recovered and there's minimal exposure risk to other people. Joining us today to discuss is Dr. Lea Monday, DMC infectious disease specialist. Thank you for being here today.
Thank you so much for having me.
So the first thing on people's minds when you hear this is how concerned should we be? This is only the first case in the state, and is it the second in the nation at this point?
Yes, that's absolutely correct. So right now there was a case previously in Texas, and now there has been this case in Michigan. And currently the patient is doing just fine, as you said, is recovering well. And the most important thing right now is that we're looking very closely at that community. Is there any person-to-person spread? And at this point, it appears that there has not been any spread from that dairy worker to their family or to the people of their Michigan community, which is very good news.
Yeah.
A lot of people are obviously on edge, especially coming out of the pandemic and all of the issues we saw there. Can you break down the fundamentals of this virus for us, and also just how this can spread from livestock directly to a person?
Right. Well, you know, influenza family of viruses are able to do things with their genetics that other viruses can't, and reassort in ways that can allow them to shift and spread from species to species. So we saw it happen from birds into cows, and then now we have cows getting people sick, as well as cases where poultry have gotten people sick previously to this. So the big concern is our health officials want to be very closely monitoring the workers on these farms, the animals on these farms, to make sure that anything with the genetics is not happening that would allow it to easily spread from person to person. When you think back about COVID, that's essentially what happened. There was an animal who was ill, somebody was exposed to that animal, got ill, but was able to infect their entire community and then subsequently many other people. So right now it's very good news that that's not what's happening, and that's what we want to make sure we monitor very closely.
So since this outbreak began, we've heard consistent updates from health officials, public health officials, that there's no risk to dairy products that you buy in the grocery store. I don't know if this is your area of expertise, but why is that? I mean, is there a certain type of dairy, if you're getting it maybe directly from a farm, that you should be concerned about?
So I think that's a really great question, and I'm a mom and my kids drink milk, so that was one of the first things I started looking into when this happened months ago and it was being detected in, you know, cattle herds in Michigan. And right now what we know is that pieces of genetic material from the virus, from the H5N1, have been detected in the milk supply in some milk in the US. That being said, these pieces don't represent live virus. Now, there's no evidence that even drinking milk with the live virus will definitely get you sick, but it's something we would not recommend.
Right.
So right now we know that there's no live virus being detected in this milk. But in addition, there's the additional step of pasteurization, which does also heat the milk to a temperature that should be able to mitigate this risk. So what I would say is people should not be consuming raw milk. You know, although it hasn't been proven to spread this, it has been proven to spread many other things, including listeria and other illnesses that are, you know, given that way. So really raw milk is dangerous regardless of the situation, and even more so now, I would encourage people to really rethink that practice.
Farmers have a list of protocols and rules to follow right now. In terms of the general public, we know that there's not an immediate danger, but out of an abundance of caution, are there things that people can be doing? Is this even something as simple as going to maybe a petting zoo or anything like that? What should people be keeping in mind?
Right, that's an excellent question. So, you know, one of the things that's really taken trend lately is people having their own chickens, their own sort of egg supplies, and I think that that's something, those birds could potentially become sick. So I would encourage anybody who has had contact either through a petting zoo, through their own home chicken egg supply, if you're having symptoms of itchy eyes, sore throat, fever, any type of flu-like illness, and you go to a doctor, you should let them know, because right now we do have the ability to send a special extra test to Lansing to have us check for this, and we want to make sure that there's no other cases going in the community, although we don't currently think that. And right now, no one outside of a big major agro-dairy institution has become positive in the U.S.
Okay, so let's say you are one of those trendy people with some chickens in the backyard or in the city. Would you notice that your chickens, your birds might have a virus? Are there obvious symptoms within the animals themselves?
The animals do get sick, and there has been significant, loss of some of these animals due to this illness. And actually, that's another big concern for the agro-dairy industry is the farmers and the people that rely on these animals and their health for their welfare. You know, the government is also watching them very closely as well. So yeah, anybody who has these animals, whether the animal is sick or not, but especially if your animals have eye discharge or appear sick, anyone with exposure and any symptoms should let their doctor know.
All right, we'll keep watching it. Thank you for all of these insightful tips that we can keep in mind. We'll have this interview posted for you on our website, cbsdetroit.com.
Thank you.